Good morning, FRCC. Today is Monday, April 1st, 2024. Today I'm talking to the Adams County Health Department about the free STI testing and other services that they'll be providing here at FRCC on Monday, April 1st, Monday, April 8th, and Tuesday, April 23rd. Welcome to FP News.
So we're with Adams County Health Department. My name's Ellen Velez. I'm the Harm Reduction Program Associate Manager.
I'm Megan Huxford. I'm a registered nurse and I'm the Sexual Health Associate Manager. And we're coming out usually at least every month, but this month we've been coming out. We have 3 days on the books. We're offering tons of different opportunities for students. We're offering testing, so chlamydia, gonorrhea testing, syphilis testing, hepatitis C, HIV testing as well. And then in addition to that, we have lots of harm reduction services we're doing.
The testing is completely free, regardless of insurance or anything along those lines. Folks can just come up to the table that we have and request a test. We're kind of chatting with folks and have additional resources at the table too. We offer point of care, so rapid testing for HIV, hepatitis C, and syphilis. So anyone interested in those tests could come back, just get a small finger prick sample, and leave with their test results within typically about 20 minutes to a half hour. We just need to fill out some paperwork and go through the process, can answer any questions. And then for chlamydia and gonorrhea testing, very similar, but that requires lab testing. So we'll ask students to complete a self-collection. We take those back, run them through the lab, and then we'll have results within
Usually within
2 weeks.
7 to 10 days.
Okay.
And then anybody who tests positive for those infections, they can go to our clinic. We're just on 122nd. We offer free treatment as well. And then if anyone has like hepatitis C or HIV, we can help link them into care.
And there's no need to make a separate appointment because all of these tests can be performed on campus.
We have a testing room down the hall that we're able to take all the samples and all the testing required from us. However, if someone wants to schedule a different appointment to come in and have maybe more of a thorough exam, go into more details about risk, anything along those lines, we can absolutely set up an appointment with them for further testing or testing on a different day. But we can do everything that we mentioned in terms of STI, HIV, and hepatitis C testing on site today or any of the days that we're here.
And there's plenty of options as to how students can get their results.
We can just deliver verbal results to folks. The tests that we run for point of care almost look like a COVID or a pregnancy test, so we can show them what it looks like to have a reactive or positive test, and they can see that, and then we can provide written results if they're interested. And then for the chlamydia and gonorrhea or lab tests that have to be sent in, folks can either call us to get their test results. Usually we will contact people if they have reactive or positive results. Otherwise, no news is good news. Is that correct?
Exactly. And if somebody wants their chlamydia and gonorrhea results, they can always call us too, and then we can actually email them their results if they're looking for like a written record too.
If you're wondering whether or not you should get tested, here's what you need to know.
So for chlamydia and gonorrhea and syphilis, we're seeing a ton of rates in the community, and so we recommend that anyone who's sexually active at least get screened annually for those. If they get a new partner or their partner has other partners, they should get screened about every 3 months if they don't have any symptoms. And if they have symptoms, of course, as soon as they have those.
There are also a number of preventative steps that you can take to reduce your risk of getting infected.
We recommend regular testing, especially with new partners, condom use, open conversations about the different types of sex and partners folks are having.
And there's a medication called PrEP. And so PrEP is a medication that you take once a day, and it significantly reduces your risk of getting HIV. So if, say, somebody were using injectable drugs, or maybe a lot of anonymous sex or multiple partners, they could qualify for PrEP, which is a really safe medication to be using. And then in some clinics, they even recommend something called doxy-PrEP, where somebody can just take doxycycline, which is an antibiotic to help prevent chlamydia, gonorrhea, and syphilis.
And I would say one additional strategy for folks that might be exploring or using any substances, especially injecting, but also snorting and smoking, there can be risk of transmission of diseases. So trying to refrain from sharing materials, reusing any materials, things along those lines, both when it comes to maybe syringes, but also even just sharing smoking supplies, and it could lead to cracked lips and then transmission of blood. So we provide a lot of those resources as well, and on the harm reduction side do more services for overdose prevention as well, but a lot of our resources and risk reduction strategies relate closely for disease transmission reduction and overdose prevention, overall safety.
In addition, Adams County Health Department has plenty of services available to help students with treatment.
At the clinic, we are a pharmacy too, and so we can dispense birth control there, we can dispense medications there. With those medications, it's really easy. Any of the STI medications are free, and then birth control is based on income. And so they just come into the clinic to get that. The things that we don't treat in our clinic for are things like hepatitis C or HIV. Now, if somebody's living with one of those infections, we work really closely with them to link them into a provider that can help them. And both of those are really treatable infections. Even hepatitis C is a curable infection in most cases. And so we're really passionate about helping people get the care.
And if you can't meet them in person, Adams County Health Department has all of their services available on their website.
If you go to our website, it's an easy place to access kind of where we're at in the community, as well as appointment lines. A lot of our handouts and tips are also online. And there's even free testing, home testing kits that you can even get mailed to you for free. And our clinic will treat you if you have any positive results too.
And I would just say additionally, from the harm reduction perspective, we have access to naloxone or Narcan, which helps reverse opioid overdoses. We have fentanyl and xylazine test strips. Just a lot of resources available for folks. All of our services and resources are available at no cost. So if there's anything you'd like to learn more about, or any services that you think might benefit you or friends or family member, we recommend reaching out. All of our services are really welcoming, non-judgmental, and we welcome any questions, whether it's on site at campus or coming down to our clinic or any of our walk-in facilities. We're typically open Monday through Friday, 5 days a week.